Well, it's Sunday and it's 11 o'clock. This is the time we record an interview every week with the Minister for Health and Social Care, David Ashford. And I mention that because it's very important. Things are moving still rapidly. And David, as we talk, Guernsey are about to have another press conference today. I watched theirs yesterday. It's very interesting the way they do theirs. It's quite a different sort of style. But they said in it, anyway, they're communicating very much with the Isle of Man and taking advice on how we've dealt so far with this lockdown. Have you found that useful, a two-way street sort of thing?
It has. It's been useful throughout the entire pandemic period. We have very close relationships with all of the public health departments in the Crown Dependencies, Guernsey and Jersey, and also very close links with Public Health England as well. And that really has helped to inform decisions. And on many things, we have worked as a team. I believe Guernsey, with their current lockdown, that they've unfortunately found themselves in a similar situation to us, and they are following pretty much the same route as we did.
Right, on lockdown, I've got a question here that we opened up on Saturday. That's just gone. Yesterday we opened up that first phase, but we're not opening the second phase until the Monday the 1st. Why not the Saturday? What's the reasoning behind that?
The reason is the number of days after the last confirmed transmission case. We want to get 14 clear days, and ideally you want to be up to 21 to 28 days. I think, as Director of Public Health has explained before at one of the briefings, 28 days is when you can effectively declare any community transmission at an end, because it's 2 life cycles of the virus. But we want to get as close to potentially 21 days as we can before releasing all restrictions. It just gives us that extra comfort over that extra weekend to make sure there isn't any community transmission occurring.
I should point out at this stage, before people start writing in, I'm asking the questions that have come in during the week, and yes, some have already been asked at press conferences, but things change. That's why the questions get re-asked. It's quite valid, isn't it, David, to do that?
Yeah, it is. Everything moves on. I mean, what you ask on a Wednesday, the answer could be different on a Friday, depending upon where things move on. So it's always wise, even if it's repeating points, just to get that across.
It's funny how people perceive these things. It's quite interesting. Anyway, now this is interesting. When you hear from the Isle of Man government, there's no evidence that X causes Y. Please, could you ask them, 1, we've looked at X and it doesn't cause Y. 2, we've looked at X, it might equal Y, but it might not and we don't know. Or 3, no one has looked at it. Do you follow that?
I do. I think what they're asking is the evidence base on various decisions. We do publish the evidence base for decisions as much as we can. In terms of evidence, obviously, here on the island, we don't have the facilities to be doing deep dives into various variant types and all the rest of it. Most of our advice comes from further afield. We look at what the CDC is doing in the in the US. We look at Public Health England. We look towards the European Centre for Disease Control as well. So we don't have the facilities to be able to do our own national drill down in that way. But all of the evidence around the virus, some very good scientific reports are there online.
This one comes up so many times, but it's, again, one worth asking. Can you ask how many people are coming back and forth to the island? It's quite shocking how many travellers we have testing positive, and they want to keep us safe and need to shut down further. And some person sent me a picture of a lorry showing 2 people on board coming in off the ferry, and they're questioning, do they really need to bring drivers across? Can't they just put the ferry crates on the boat and leave it like that?
Well, sometimes it's not as simple as a delivery in terms of lorries. They may actually be here for a specified purpose to do with what they're carrying. So, for instance, with the oxygen deliveries that we have to the hospital, it comes over with the tanker with the driver, because the driver is qualified to unload that tanker as well. And obviously around oxygen, there's very serious risks in relation to fire, explosion, etc. It has to be qualified personnel. So just because you see someone in a cabin doesn't mean they're just a lorry driver. They may have another function too. In terms of the pandemic response. Say the first point again for me, Paul.
Well, about people just coming in,
travellers. So in terms of the pandemic response and travellers, in relation to our travel numbers, in December, and I do have to caveat this was December because it was Christmas period as well, it was averaging around about 700 travellers a week, backwards and forwards. In relation to now, the numbers have dropped to around about 200. Now, it also has to be caveated that includes patient transfers. So when you consider that we still have to send people away, the numbers travelling at the moment is actually exceptionally low.
And obviously a lot of people are still just concerned about key workers in the sense of obviously the promenade's about to start again. You did tighten up, didn't you, on the key worker status, though, at some point?
Yes, I mean, the definition around key workers was looked at after we had the issue with the welders, which people will remember, and it was tightened up in terms of the sign-off as well for key workers coming in. It is exceptionally tight, but we do have to recognise, as an island, we don't have the resource to do everything on island. And even with our best endeavours, there are certain things that we will have to bring resource in. What is important is the mitigation measures we put around that. I've got to say, actually, when you consider the amount of key workers we bring in for things, including DHSC, for health and social care, when you look at the instances that we've had of issues or problems or even people trying to breach it, it's exceptionally low as a percentage. And in terms of outbreaks, obviously this current outbreak had nothing to do with key workers.
Could you ask what the uptake rate on the vaccine is? I'm sure you get asked this every day. I think we've kind of come on this many times before. People are fascinated to know, obviously, how many people are taking it, how many people are offered it, how many booked appointments there are. All that information, though, is meant to be on your website. I'm still thinking it's not quite as clear as it possibly could be. But the main question is, what's the uptake rate?
Yeah, on the website, though, just to come on to that point, so on the website there will be going up Power BI dashboards, so people will have all the data and they can play around with the data and make graphs, etc. That's in the process of being finalised and pulled together. There's been an awful lot of work within the teams to pull all that together, so we've got something that we can do front-facing. In terms of take-up, it's exceptionally high. It's well over, I believe, the 90% mark of people who've had letters go out that have now booked appointments. In terms of nursing homes as well, for those that have capacity, because those who don't have capacity, it's slightly different. There's a process we have to go through. For those that have capacity to make decisions for themselves, again, I believe it's well over the 90% mark.
And so many people still looking at the other Crown dependencies and seeing that there's more vaccinations. And now I know Jersey's got a bigger population, Guernsey has less, but they seem to have got more in. And I think that was a question I was trying to get to you on the last press conference, although the Chief Minister cut me off because I couldn't quite get the answer I was looking for to clarify. When I said, are you getting everything you want? I mean, there's been no hold up, I suppose. That's the thing. The deliveries you're getting are exactly what you were expecting, nothing more, nothing less?
Yes, we are receiving 0.13% of the UK deliveries. The delivery schedules into the UK are changing all the time. So, for instance, the other day, delivery schedules changed twice in one single day. But that's the stock the UK is receiving. Our share of the stock of the UK is exactly what it should be based on population. In terms of Jersey and Guernsey, the big difference is Jersey and Guernsey have gone down the UK route, which we have not, of administering the dose later. So that's meant they've prioritised doing first dose. The clinical advice over here, as I said at the press conference, is split. There is a difference of opinion, but we have made the decision to stick with delivering 21 and 28 days for the Pfizer and the Oxford vaccine, respectively. Basically, we are keeping the stock to ensure that we have that second dose. So anyone who has had their first dose over here is guaranteed, even if there's disruption to the delivery schedules, they are guaranteed they will get that second dose.
Well, you're going with WHO, certainly, and the UK seems to be out on a limb on that one. But I'm guessing this could change. I mean, you know, no masks never, then there are masks. I mean, is it possible that you could come back one day and say, well, we've had to rethink this and we are going to change?
We review all our decisions constantly, Paul. I mean, every decision is reviewed every 2 weeks, and this is absolutely no different. But on balance, the clinical view at the moment and the recommendation to myself as Minister from the Clinical Advisory Group and the executive team in DHSC was to remain as is. It is, as you say, what most of the world is doing. The UK is a bit of an outlier at the moment, but we are sticking with the 21 and 28 days. And because of the way we manage our shipments and our deliveries, it means that we actually can guarantee that second dose. The other thing I should say is, even although at the moment it may seem that these other jurisdictions are ahead because of the way they're delivering the first dose, over a period of time of the vaccination programme, we actually catch up. So by May, we will have delivered, by the end of May, first and second dose to everyone who is aged 50 or above and all those in the vulnerable category. The UK at the moment has only committed to people in that category having received an invitation for vaccination.